Gosh, when I started, I get to sit, I can take as much time with each participant that I want. I can really listen to their concerns. I remember in medical school, they tell you, if you listen to the patient, they'll tell you what's wrong with them. And there's a lot of truth in that if you just really take the time. And they are such wonderful people, and they just appreciate everything that you do. So just that in and of itself has just made my job so much more fulfilling. I just feel like I'm really doing what a physician is supposed to do. I think we make a huge impact on participants' lives. We do so many different things. We not only supply their medical care, but we oversee all their drug use, so we know exactly what prescriptions they're on. Where when you're in private practice, they're coming to you with, I got this prescription from the cardiologist, this one from the neurologist. We're the ones that are in charge of that. We can see them feeling better. If they're sick, we can see them right away. They don't have to wait 2 weeks for an office visit. Gosh, if they're in the day room, they're not feeling well, they've had the flu, we can bring them back, we can put an IV in them, we can start IV fluids, we can get them nauseated, we can give them medications. We don't have to have them go to the ER. I always tell them right from the start, our purpose is to keep you home, keep you safe, keep you out of the ER, keep you out of the hospital, and they don't want to be there. So they just see it as a great service. I think our statistics will show that we're much lower than the national average as far as people being in the hospital, being readmitted to the hospital, going to nursing homes. I know we're making a big impact on people's lives. One statistic that I do know is that every patient or participant that comes here has a high risk of going to a nursing home, but over a 4-year period only about 7% or less end up going to a nursing home. So that's a statistic that we can be quite proud of. We sit down every 6 months and talk about each patient, come up with what we call a care plan, which every specialty has seen that, reevaluated that participant. And by sitting down and everybody meeting with them again, we can find out, yeah, this has changed, they need a little bit more help here, we need to get someone in the home and help them. So it's just a group effort, I would say, and you can't just have a physician doing that. You really need a pharmacist, you really need a social worker, you really need somebody from PT, OT, all to give their own contribution. It's a complete way to take care of the patient, and I think it really helps them stay home and stay safe. I would have to say, too, that the other aspect of it that's so fulfilling is I love going out and doing house calls, which we do quite often if they're not able to come in, they're just too sick or they just don't feel like coming in. And there was one participant that called in and he wasn't feeling well and he was coughing and he had a fever and he was too weak to come in. So I had a resident that was working with me, so we trotted out there, he had all of our lab draw things, and we got him set up for a chest x-ray and everything, and he was so appreciative. He said, if you guys wouldn't have come out here, I could have died or I'd ended up in the hospital. So to me that it's just a marvelous feeling to be able to help him, and he felt so wonderful that we cared that much, and we really do. We care about these participants. You almost become like family, really, because it's like your mother, your grandmother. You want them to have the best care, and the fact that you can really give it to them is just very fulfilling as a physician.